I'm joined today with Dr. Sarah Myhill. She's a naturopathic physician, a keynote speaker at various health forums and conferences, author of countless books on health and well-being, and I must say, a genius in her field. Thank you very much. Welcome.
Kind. You're very kind. Thank you very much indeed.
It's all true. So if you could just tell us, how did you get into medicine?
Okay. Well, I got into the medicine for the very poor reason that I come from a long line of doctors, so there didn't seem to be any choice at all. But I did love my medical training, qualified as a doctor in 1981, and I went straight into general practice. And I very quickly became aware of the fact that I was not prepared for general practice at all. Because, you know, medical training is all about drugs, symptoms, especially drugs, whereas, you know, most people want to know why they've got their headache, you know, why they've got their high blood pressure, you know, why they've got their arthritis, and what we can do to sort it out like that. And it's just so obvious, isn't it? In fact, any problem that you encounter, you have to ask, you know, why have we got the problems? You know, what is the mechanism of that problem so we can fix it? And it's the same with medicine. You know, those symptoms are there because they mean something. They mean something is going wrong. So let's try and work from the symptoms and see what's going wrong. Of course, I wasn't prepared for that at all. And when people came and said, you know, why have I got migraine? I'd say, oh, actually, I've got no idea. I can give you some pills to help it go away, but I've got no idea why you got it. Anyway, I worked with a very loving and forgiving group of people who didn't mind me saying, I really don't know. But it's all about asking the right questions. And from that, I learned that many cases of migraine, irritable bowel, were due to allergy to foods. I learned that many cases of cancer and dementia and heart disease were due to deficiency of micronutrients. When I moved to Wales in 1989, I started working with farmers who had been poisoned by agricultural chemicals, and I realized that many conditions were associated with the poisoning. So fast forward to the present day, because I've now done 4 decades of general practice in either in the NHS or independent practice, and I've now got a much better grip of what's going on. And the group of people who have been the worst treated of them all are those with fatigue syndrome. And I mean, even when I was in practice in the 1980s, you know, there was an acronym, TATT, tired all the time. You know, tired all the time was about 40% of all consultations then. And the doctors, again, they weren't looking for the root causes then. They weren't asking the question, why then? Now, I promise you, I don't know all the answers, but I've now got a framework that everybody can work through with respect to diet, supplements, mitochondrial function, thyroid stuff, adrenal, all that stuff, which gets most people, if not completely well, it gets them improved. It gets them on the path to recovery. Because the fact of the matter is everybody's path is a little bit different. So I can give you, you know, the general rules of the game and the tools of the trade, as I call it, but everybody plays that game in a different way. Now, I'm a cricket fan. I love cricket, and the analogy is perfect because in cricket, the rules of the game are the same. You know, the tools of the trade are the same. Everybody's got a bat, a ball, some sticks, you know, big flat grassy area, but everybody plays it differently. And it's the same with getting well from this illness. So what I try to do as a physician, but also as an author, because, you know, this information just isn't out there, is I try to put this into words that we can all understand, words of the, you know, I like to speak plain English, and I use swear words where necessary to get my message across. I like to speak plain English, and there it is in the books, how to actually do it. But you know, it's not easy. It means major lifestyle changes. But you know, it's the old story. You know, I always think that health is like wealth. You don't know you've got it until you've lost it. You know, and rich people can talk about poor people, and they haven't got a clue what it really feels like. And it's the same about healthy people. They really haven't got a clue what sick people feel like until you've actually been there and done that. So you know, I waffled a bit, I'm afraid. Forgive me, but you know. Ask me a question, you know, what do you want me to talk about?
Okay. What are the typical conditions that you treat?
Absolutely everything. I mean, the point about this approach is it's not disease specific, because the starting point of Western disease is nearly always the same, and it just manifests differently in different people. So and problems have flared in the last 4 decades, the last 40 years, during my lifetime as a doctor, because our diets have changed so drastically. Now, when I was a kid brought up in the 1960s, it was go to work on an egg. And, my mum cooked me, okay, I was from a wealthy family, I was very privileged, but we always went to school with bacon and eggs and fried bread. And did I get hungry in the day? No. What was school lunch? Meat and vegetables. What was supper? Meat and vegetables. No pudding, no sweets, no snacks. They were absolutely forbidden. But nowadays, people fuel their bodies with sugars and carbohydrates. And the trouble is they're addictive. And we eat them in an addictive way. And you have, a fast carb like, breakfast cereal, toast, marmalade, fruit, chocolate, crisps, snacks, McDonald's, whatever, much of it is what we call junk food. And we get an immediate hit. And it's an immediate energy hit. We feel a bit better, we feel a bit calmer, but it's short-lived, it's ephemeral. And that, of course, is the basis of all addiction. All addiction is about short-term gain and long-term pain. And most people know the major addictions. It's caffeine, it's nicotine, it's alcohol, it's cannabis, and they recognize they can get short-term relief with that. But what most people haven't worked out is that the worst and the most pernicious and the most convenient and the most widely used addiction of all is to sugar, carbohydrates, starches, and junk food. And that is the basis of modern pathology and cancer. Cancer cells can only survive on sugar. Dementia is now being called type 3 diabetes. It's diabetes of the brain. Heart disease and arteries are damaged by sugar because sugar is sticky stuff. It physically sticks to arteries and damages them. And then cholesterol only comes in as part of healing and repair. So cholesterol doesn't cause arterial disease. It's a symptom of arterial disease. Something that the medical profession got completely wrong and completely upside down. So if I'm really thinking about disease from causation, from the point of view of causation, we can then treat it, because all these pathologies can be reversed with these interventions. Now, of course, we shouldn't wait until we get pathology before we start to make the necessary lifestyle changes. We should do it now. Because if by the time somebody comes to see me with advanced cancer, yeah, of course they're going to need the chemotherapy, of course they're going to need the surgery and all that, but they shouldn't get it in the first place. But I've got, I don't say hundreds, but certainly tens of cancer patients who, yes, they've had the surgery, they've had the chemotherapy, they've had the radiotherapy, and they say, where do we go from now? And the answer is, don't feed those cancer cells. Starve them. Don't give them sugar. Don't give them junk food. Don't give them fruit sugar, which just feeds them. Nourish your body with ketones, and that comes from eating fat and from eating fiber. And don't use the growth promoting foods. Dairy products are growth promoting. They are a major risk factor for cancer. And you can stop people's secondaries. You can, in some cases, you can reverse the cancer, but it's hard work. But of course, that's better than dying, which is the alternative. Not for me. I'm enjoying life too much. I don't want to die yet. So, and I call these regimes, the diets, I call them groundhog regimes. And the reason I call them groundhog regimes is because, like at the film Groundhog Day, which, as you know, is a comedy, and our hero, it's a time loop, and he comes back to the beginning of his day and thinks, can I lead that day any differently for get another outcome? I call them groundhog because I keep coming back to them over and over and over again. And they're repeated ad nauseum in my book, as you know. And groundhog basic is what we should all be doing all the time. Don't wait till you've got a disease. Don't wait until you're fatigued. Don't wait until you're not functioning to your full potential. Do it now. But of course, nobody comes to me, feeling well and wanting to put groundhog basic in place. And then I have groundhog acute. Now, I worked this out when I wrote one of my books, The Infection Game, because I discovered from my researches, as I was researching the background of that, all pathologies have an infectious driver. The one we all know about is HIV, can cause AIDS and Kaposi's sarcoma. But lymphomas and leukemias are often driven by viruses, often retroviruses. Epstein-Barr virus, which is a really nasty little virus that we've all got on board, 90% will test positive. We know that drives a host of leukemias and lymphomas, and in some women, breast cancer. In Africa, of course, Burkitt's lymphoma. So when I started looking from a pathology-driven thing, I couldn't find a pathology that didn't have an infectious driver. So then that begs the question, how do these infections get into us? And of course, they get into us when we get coughs and colds and sexually transmitted diseases and all that. So then I developed the idea of groundhog acute. And groundhog acute is what we should put in place at the first hint of any infection. And it doesn't matter what it is, COVID-19, runny nose, coughs, gastroenteritis. Groundhog acute interventions are to reduce the infectious load and to give the immune system the raw materials it needs to fight that infection. So to get that infection out of the body quickly before it becomes chronic. And then, of course, people come to me with disease. And then we have not the different, based on groundhog basic and groundhog acute, we have groundhog chronic. That's what we put in place with chronic disease. And it's all that's gone before, plus maybe other interventions. So people who've been poisoned, we add in detox regimes to reduce their toxic load. And there are lots of ways we can do that. It might be heavy metals, it might be pesticides, it might be photographic chemicals, it can be anything. We put in place interventions to reduce the infectious load, like high dose iodine. Very often it's disrupt them hormonally, so we look at thyroid and adrenal function. So groundhog chronic is all that's gone before, plus these added bolt-on extras. And all these things are dead easy, easy to do in theory, hard to do in practice, but they are within everybody's grasp. So there's very little that I put in my book that you can't do yourself. You don't have to go to some expensive clinic in South America and have gene therapy or a stem cell therapy or something like that. This is all basic, simple stuff. And it's called naturopathic medicine. It's what we did before we had all these drugs. I mean, if I had lived 1,000 years ago, I'm quite sure I'd have been burnt at the stake as a witch.
No.
One of the original witch doctors. I'm very proud to be that too. In fact, that's my family. As I mentioned earlier, I come from a long line of doctors, and in the family, I'm known as the witch doctor.
Excellent. One question which most people will be thinking was that I go into these diets, when will I get better? How long will it take to see results?
This is not a battle, it's a war. And it's a war that we fight for life. Now, we know it's going to be a war that we will lose, but if I lose that war when I'm 100, I will settle for that. So the answer is, it depends on your starting off point. Now, if you're somebody who's normally fit and well and wants to improve their athletic performance, for example, because these interventions, we can use for that reason. I have seen many top athletes. You will see improvements very quickly. Within 2 or 3 weeks, your energy will come back, your head will clear. On average, the endurance athletes can improve their performance between 7 and 15% just by getting ketosis. And one example of that is the world record for the furthest distance run in 24 hours is held by a keto-adapted athlete. He's called Mike Morton. And in 24 hours, he ran 172 miles. Why? Because he could fuel his body from the fat in his body, and he could run and run and run. Yes, he needed water to hydrate, but he didn't have to stop for gels and snacks and food. So if you're from a good starting point, you can get better very quickly. If you're from a bad starting point, if you had fatigue syndromes for years, you've been poisoned for decades, you've had fermenting gut for your life, then it takes longer. And as the body starts to heal and repair, initially you can get worsening, and that's called a healing crisis. It's very well recognized by doctors who practice functional medicine or naturopathic medicine or homeopathic medicine. And that's what makes the journey so difficult, because they come to me thinking I'm going to make them better, and initially we might make them worse. And I call these reactions D reactions: diet, die-off, and detox reactions. Diet reactions because you get addicted to foods, and often we are allergic to foods, and allergy and addiction are two sides of the same coin. So initially you can get withdrawal symptoms. Detox reactions, because as we put all these things in place, we start to mobilize toxins in our fat, and that gives us an acute poisoning. And die-off reactions, because again, as we put all these interventions in place, we reduce the load of infections in our body. It might be viruses, might be bacteria, might be yeast. And as they die off, we get what's called Herxheimer reactions. So it's a bumpy ride. So not only am I telling people to make major lifestyle changes, which are difficult, I'm then going to give them a bumpy ride thereafter. And how can they escape from that bumpy ride? By going back to their addiction. You know, they can get rid of those nasty symptoms by going back to their sugar or their caffeine or their alcohol or whatever to relieve those symptoms. So it isn't easy. And that's why not many people do this really well. But when you're really sick, when you're really not functioning, you are very well motivated. And the first lesson I say to my patients is, there's only one person that's going to get you well, and that's you. You know, I can shout advice from the sidelines, I can cheer, I can jump up and down and wave, but there's only one person that can walk the path, and that's you. And obviously I can help and encourage and cajole, but you've got to do it. And that's the hard bit, because we're in a care system, of the natural health system, the national health system, where somehow the onus is on the doctor to sort you. You know, you go to the doctor, give me a drug to fix what I've got. And the drugs are often symptom suppressing. And in the short term, they do feel a bit better. Now that's very seductive. And it's very nice to get rid of those nasty symptoms, which might be pain, which might be fatigue, that might be inflammation. And we have lots of anti-inflammatory drugs and painkillers, but they're not getting at the root cause of. And in fact, symptoms are very important, because symptoms tell us we're doing something wrong. And there's nothing more motivating than a nasty symptom as to make you change your wicked ways. And if you have a terrible pain, you will do anything to get rid of it. And painkillers are not the answer. We have to ask the question, why?
Great. You mentioned something about the fermenting gut. For a layperson, where's the gut and why is it fermenting?
Okay. It's a big problem. Now, the gut is obviously how we deal with food. The gut is how we take food into our bodies and convert it into fuel that the body can use. Now, for millions of years, primitive man has run, his primary fuel has been ketones, and he's got that from eating fat and from eating fiber. Now, yes, there was a window of time in the autumn where he could eat carbohydrates because they were there in abundance. And the autumn is a very good time to get fat. And of course, he would eat those foods in an addictive way. So the fruit, all the carbohydrates we talked about, the root vegetables, the pulses, the grains, the fruit, he would eat those in an addictive way and get fat. And that's survival value for the winter. Now, if we are eating a fat-based diet and protein and carbohydrate, the upper gut is a sterile, carnivorous gut, like my dog's. The lower gut normally is where, that's the colon, that's where we deal with fiber. And my lower gut is a fermenting gut, like my horse. So my upper gut is carnivorous and my lower gut is vegetarian. It allows humans to eat a very wide range of foods. But if we have a lot of sugars and a lot of carbohydrates, we overwhelm the ability of our upper gut to deal with that. So with age, it becomes more and more common. And if you have enough sugars, then you will turn that upper gut into a vegetarian fermenting gut instead of a sterile carnivorous gut. And that causes problems, because when you start to ferment sugars, what do you produce? Well, one thing you produce is alcohol. It's called the auto-brewery syndrome. So if you've got yeast in your upper stomach and you have sugar, then of course fruit is a combination of sugar covered with yeast, grapes, apples, for example, you will ferment and you produce alcohol. And if you gave me a glass of wine for breakfast, would I be able to function that day? I don't think so. I'd be tired and foggy-brained all day. But it's not just alcohol that foods can be fermented to, all sorts of other things. So ethyl alcohol, but also methyl alcohol, propyl alcohol, butyl alcohol, hydrogen sulfide, D-lactate, aminoalkyl compounds, and all these things give us a poisoning. And on top of that, if you're feeding all these bacteria and yeast that are fermenting in the upper gut, which should not be there, they produce toxins too. So we get bacterial endotoxin, which poisons us. We get fungal mycotoxins, which poison us. And they all have their load of viruses, which are called bacteriophages, and nobody knows what they do. So the upper gut basically amounts to a poisoning. And one of the cardinal symptoms of upper fermenting gut is foggy brain. And so often people tell me that when they do a ketogenic diet, when they cut out those sugars and carbohydrates, not only does their energy improve, but their brain clears. And suddenly they can think clearly, they can think quickly, they can be witty, they can be funny, they can be good at their jobs. And guess what? Brains are awfully important things. So the fermenting gut is a big problem. Oh, and another problem with the fermenting gut is, I went to medical school. At medical school, we were taught, yes, the lower gut is full of bacteria, but there they stay. And we now know that's not true. We now know that microbes in the gut, wherever they happen to be, in the mouth, in the esophagus, in the stomach, some of them will spill over into the bloodstream. So one example of this that you may be familiar with, if you go to the dentist and you've got a heart problem, he will insist on you taking antibiotics before any dental procedure. Why? Because dental bacteria get into the bloodstream. You can find them in the bloodstream within minutes of any chewing or eating or dental procedure, with the potential to infect the heart. Now, that process is called bacterial translocation. Now, if those microbes getting across the gut wall in the lower bowel are the friendly microbes that the immune system's been looking at for hundreds of thousands of years, no problem. Oh, they're friendly, they come out in the urine, end of story. But if they are unfriendly, unfamiliar microbes, yeast maybe in the upper gut, that's a problem. Because if wherever those microbes get stuck, they can drive inflammation. And I'm quite sure now that many pathologies are driven by microbes spilling over from the fermenting gut. So in the muscles, fibromyalgia, in the joints, arthritis, in the arteries, temporal arteritis, polymyalgia rheumatica, I suspect chronic urticaria, Crohn's disease, intrinsic asthma, probably dementia, venous ulcers. All these are driven by allergy to microbes from the fermenting gut. How do we treat that? With groundhog regimes. Starve them out, don't feed them with sugars and carbohydrates, get onto ketogenic gut, and then kill them with natural antimicrobials like vitamin C, like iodine, like herbs. So it's all back to basics. And so many, what you might think be complex pathologies, autoimmunity, whatever, the track, the trail, the detective story goes back down to the absolute basics of diet and such. So fermenting gut, big subject. I could bore you to death by talking all down there. I shan't do that.
No, it's wonderful. I mean, I love hearing you. It's wonderful. Another question. So a patient goes, sometimes I get this question and they ask, what success rate do you get? Say out of 100, out of the patients globally that you see, what success rate do you get?
And the answer is, I don't know the answer to that. But what I do know is that those people who do their regimes and stick with them, I think it's fair to say almost invariably see improvements. So it depends how you define success, because as I say, the regimes are difficult. So they've got to be done, but everybody without exception is going to improve their health hopefully in the immediate short term, but certainly in the long term by doing these regimes. So it's hard work in the immediate short term, but once the regimes are established, they're easy. They just become part of normal life, and then you've got the energy to go out and do things and have fun. So I'd hate to say what my success rate is, because it depends on where the pathology is, how well, what stage. For people who have had multiple secondaries for cancer for some time, not good, obviously, because they've got advanced pathology. For advanced dementia, ditto the same. But most people do very well, thank you very much. It just depends at which point you get them and how determined they are to do the regimes. And this is one of the reasons why I say to people, do not take symptom suppressing drugs, because symptoms are very empowering. They're painful. They stop us doing things. They stop us sleeping. They make life very uncomfortable. And that makes you put the changes in place, however hard they may be.
Lovely, excellent. And finally, you've already mentioned it before, but any, say, top 3 tips to live a pain-free life?
Always ask the question why. Go back to first principles. Pain is nature's way of saying you're doing something very wrong. And primitive man may have had a boring life, but if he was free from injury and free from starvation and free from the cold, he was an incredibly, or rather she was a very incredibly busy and active person, because if she hadn't been, she would not have survived. So always ask the question why, and don't take symptom suppression medication, which is often painkillers, because that empowers you to make the change. And dare I say, go and get some of my books and read out how to find out how to do it, because it's all there. And I don't have any secrets. I don't want people to come and see me because I'm so busy I can't take on new patients. Have a look at my website first. The information is there free. The information on my website isn't perfectly up to date, because if I put all my books on my website for nothing, my publisher would decapitate me. So that's no good. But there's a lot of information there. I looked the other day, it's had 22 million hits. So there are other people out there who are looking at it and have presumably been helped by that. But the groundhog regimes are there. And most of how to do the groundhog regimes are there on my website with links. In fact, as I'm speaking now, Craig Robinson, with whom I write the books with, I do the writing and he does the editing. He's going through my website to make it more clear and more slick so it works more efficiently. So go there first and get a few tips from that. But then, as I say in all my books, just do it. Don't ask for questions. Don't ask for permission. Don't postpone it. Don't prevaricate. Just do it now. And the sooner you do it, the better you'll be.
Lovely. Excellent. And your website is?
If you just Google Dr Myhill, Myhill as opposed to Your Hill, it comes up. So I think it's co.uk, but yeah, that's the way to find it.
And finally, you said you're not taking on new patients, or will you not take any patients at all? Or?
Well, it's because, the way that I do things these days is because my groundhog regimes are so standard, I run workshops. And I can treat, see, advise, lecture 20 people at a time. I used to do it before COVID came along by driving around the country, and I'd have a workshop in Yorkshire or Liverpool or whatever, and they were great fun, but jolly hard work, I have to say. But now, of course, I can do them with Zoom. And it's so amazing because I can see, I've got Ethernet connections, so I've got great connectivity. I can see 20 people at a time. They can see me, and I start at 9:30 in the morning. And we talk through till 4 o'clock with a lunch break. And I go through all my regimes. And the deal is anybody can ask any question at any time. Just wave at me and I stop and I ask the question and away we go. So we end off going over all sorts of tangents, talking about all sorts of things. But most people join the workshops because they've got chronic fatigue or ME. As I say, the workup, I have patients with Parkinson's disease, I have patients with cancer, I have patients with inflammatory bowel disease, because the basic workup, how to put all these things in place, is the same. And we get very good results. I then run follow-up workshops, and roughly speaking, we have about 20 at the starter workshops. The follow-up ones usually about 6. So that suggests to me that I'm probably getting the majority of people, considerably better just by doing a starter workshop, because they're not coming to the follow-ups. I don't know if that's right or wrong, but it's a little hint that we're doing something right. And very often people who come to the starter workshop are already on that journey. They've already done the PK diet, and they can encourage the others by saying, "Oh yes, that was the best thing I ever did. Yes, it's hard work, but you get stuck here." So there's quite a lot of good interaction, and they're always fun days. So if you want to do that, go to my website. There's a link where you can buy a ticket at my shop, and with that ticket, I send you an invitation, and we have a jolly day together.
Lovely. And that's called a workshop
Yeah,
on your website.
Absolutely, yeah.
Brilliant, lovely, excellent. It's been amazing. Thank you very much. It's been amazing and really fun and very, great experience to have you. Thank you very much.
Bless you. You're very kind. You are a very good interview because you always ask the right question. That helps a lot. Righty-ho.